Good evening all. Today we are going to have a short game with the preoperative checklist. Okay. Here I have sheets of checklist and you want to align that with the protocol. Okay. So you can take 5 from this and you can start arranging. Before arranging, just say what is this and you can arrange it accordingly. Okay. You can take this. You can take 5. You just say what is that and you can place it.
Okay. Blood work completed. CBC, coagulation, electrolytes, renal, LAFTs. I am placing into laboratory and diagnosis.
Okay. Okay. Okay.
Surgical site cleaned with antiseptic solution. I place with skin preparation.
Very good. Place it, skin.
Preoperative medicine.
Okay. What is your topic?
Preoperative medicine.
Preoperative process.
Preoperative medicine, administrator, anesthesia, anatomy, antibiotics.
Okay. Very good. Okay. Okay.
Chest X-ray, indicator,
Review.
laboratory diagnosis.
Very good.
Solid food stopped 8 hours prior, prayer liquids 2 hours prior. I'm going with fasting and nutritional status.
Surgical site marked and verified by surgeon. Patient identification.
Very good. Vishnu.
Procedure, anesthesia, post-operative care explained. Patient identification consent.
Very good.
All documentation complete and identification chart.
Okay.
Patient identification.
Okay.
Preoperative medicines. Blood thinker, aspirin, warfarin, etc. held approximately.
Okay.
ECG, if greater 50 years of cardiac history review. Final verification.
Anesthesia preparation.
Okay.
Hand from holding area authorized by surgeon or anesthesia.
Okay. So Sanjeev completed.
Final verification, advanced directive living will review.
Okay.
Allergen documented and valid update. Medication data export. Supply. Electrolyte cross-matched and available. Its order. Patient in room. Grown tight properly.
Patient is known, tied properly.
Goes to laboratory and diagnosis. Oral hypoglycemic will insulin per protocol. Patient identification and counseling.
So if you feel anything you want to change, we can consult and change.
The products cross-matched and available is order and the patient in gown tied properly. I place it into pre-operative medications.
If you want to, we'll start with patient identification concern. In patient identification concern, the first one is like, what is the one?
Surgical site and verification by surgeon.
Okay, second one?
Procedure, anesthesia, post-operative care, explain.
Yeah, this is also related to the patient. Next.
All documentation complete and with patient chart.
So how come this comes under patient identification? The documents are this one. It has to be completed.
Final verification.
Take this and place in final verification. It can come under preoperative or nutritional or fasting status. Why? Because the patient is coming under oral. We are placing the patient with the oral hypoglycemia. Medical history and assessment. Allergic reactions are documented. It's correct. What comes under diagnostic and laboratory?
Blood, CBSE, coagulation, alcohols, and renal.
Okay. Next.